Hello everyone, myself Himani Sharma from DMLTD Pharma Department, RPIIT campus. Types of the Haital hernia is my today topic. Haital hernia are the classified into three major types. Sliding type is the most common, characterized by an upward herniation of cardia and G junction. Fixed hernia characterized by an upward hernia of the gastric fundus, cardia and the G in are in normal place. There are the structure of the stomach, cardia part, the cardia notch, and esophagus, pylorus, duodenum, pyloretic atrium, body, and fundus. They are the normal stomach, diaphragm, and sliding hiatus hernia. And next is the paraesophagus hiatus hernia. The complicated type is the most serious and least common form of the hiatal hernia. This form include a variety of the herniations pattern of the stomach, including those in which the entire stomach moves into the chest. Oral health consideration: if a hiatal hernia is treated with the medication that cause the dry mouth, the dose or drug type may need to be altered by patient's physician. Various treatment modalities for the dry mouth, such as the artificial saliva, alcohol-free mouthwashes, or increased fluid intake, may need to be prescribed. If reflux or into the oral cavity is present, oral manifestations that are the same as those of the GERD may be present. Disease of the lower digestive tract. There are disorder of the intestine, duodenal ulcers disease. A duodenal ulcer represents a break through the mucosa into the submucosa or deeper. The base of the ulcer is the necrotic tissue consisting of the pus and fibrin. When the ulcer erodes into an adjacent blood vessels, there is the hemorrhage. If erosions continue through the serous outer layer of the duodenum, adjacent organs, or perforation into the peritoneal cavity occur. When conditions are favorable, the ulcer heals with the granulation tissue and new epithelium. If the ulcer is present for the prolonged period, it becomes associated with the scar tissue and possible deformity. Etiological factor: the most common primary causes is the H. pylori infections, aspirin, ibuprofen, and other NSAIDs. Less commonly, factors such as the stress, parathyroid disease, malignant carcinoids, and chronic lung disease have been associated with their duodenal ulcers. The ulceration is usually located in the first part of the duodenum because the acid chyme ordinarily become alkaline after pancreatic secretions after the enter the intestines in the second part of the duodenum. In today's class, I discuss about oral health condition, types of the hiatal hernia, and about their types and oral consideration. Disease of the lower digestive tract, that is duodenal ulcer disease. Thank you for watching.